11:30 this Thursday. We've talked a lot about kids heading back to school here on WFAA, and as they get back to the classroom, you may have to check up scheduled with their doctor. It's kind of that time of year. Something you should also consider is getting them into a pediatric dermatologist. And we are welcoming Dr. Nina Agim with North Texas Dermatology Associates in studio now. And I mentioned to you during the break that we've been to a pediatric dermatologist before and kind of seen firsthand some of those benefits. But for folks that haven't, why is it important to consider scheduling that kind of an appointment?
So anyone that has skin may have an issue with their skin, and it's something people see. We've talked a lot about mental health for children, and having a visible difference can impact a child's performance in school. And so from birthmarks to acne that a lot of people suffer from, pediatric dermatologists are trained to help take care of noticing what is worrisome versus what is no worries, and go about with your day. And so I would recommend that any pediatric patient should have a visit with a pediatric dermatologist at some point.
Well, I think you mentioned a couple of issues that are probably familiar to a lot of folks out there, parents or not, when you talk about different skin issues, acne, birthmarks, etc. But how do those skin issues differ in a kid than in an adult?
Yes. So some birthmarks have a very different appearance when they first show up in a child's skin. So they may look different when the baby is 6 months old versus when they're 18. Some birthmarks are an opportunity to look for other problems that may be internal, and some birthmarks disappear by adulthood. So getting in when you first notice these things is important to make sure that you're dealing with something that either you don't have to worry about, or if there's workup needed, if there's care needed, that can be performed.
Well, I think too, as a parent, a lot of times you see something that kind of gets you nervous, and it's helpful to have some insight. And you know what? This is one of those things you can kind of just watch and wait for a while, or maybe you need to do something about it. Let's talk though about some of the common concerns when it comes to skin checks for kids. Certainly we talk a lot about the skin cancer that adults have to deal with.
Yes.
What are you looking for when you have a kid come into your office?
So believe it or not, skin cancer can occur in children. Sometimes it happens if they have a genetic background or a reason that increases their risk, for example, to sun exposure, and sun exposure causing the skin cancer. So we're looking for moles that are atypical, whether they're different in color, shape, size, or behavior. If they're particularly symptomatic, if they show up all of a sudden, if they're bleeding, those could be reasons for concern.
Certainly a lot of the attention around dermatology for kids, especially teenagers, is about acne. What percentage of your patients is that their number one concern? Well,
acne affects 80 to 90% of humans, period. And puberty is when most people's acne shows up.
Those are some bad memories.
Yeah. So we have a lot of teenagers who come in for their acne, and especially high schoolers. If they're moving schools, if it's senior year, a lot of times it's a big deal. They want to make sure they have that taken care of.
Well, I would imagine it's a lot easier to start and to kind of get ahead of the problem.
Yes.
All right.
Yes.
Some good advice, Dr. Agim. I appreciate you sharing that with us today. And boy, when you talk about acne as a teenager, not great memories, Greg Fields. I remember those days and that embarrassment. So a good reminder to go get it checked out. Yep.